Hello, everybody. This is Dr. Kashif Abdullah speaking to you today. It is April the 9th, Thursday, April 9th, 2020. What's that? Hello there. It's a question. And I'm doing my daily question and answer for coronavirus. And I'm going to also open this up to childhood illnesses as well. I'm going to do a PowerPoint. I'm going to do a presentation on that. And then I'm also going to make a video on that as well later on. And if you have any topics you'd like to discuss, please feel free to ask them here, or you can even send me a direct message. All right, so let me switch screens here for a bit. Okay, there we go. And let's refresh this page. So if we see here today, we have now 1,536,979 confirmed cases as of right now from the Johns Hopkins coronavirus website. We can see that there are now 73,000 unfortunate deaths. And the US is still number one, of course, in the number, and I think no other country is going to surpass the US. They are literally the combination of Spain, Italy, and Germany combined. If you combine all those nations together, the US is more than all three countries combined, and eventually I think it'll be all four countries combined with France. So if we look at the daily increases in cases, we can see that there is a market, well, not a market, but there's basically it's about to stabilize. It hasn't come down yet, so we're hitting our peak right about now. And if we look at Spain, we can see that they're falling. Italy is also falling. Germany is they were falling, but then went up a bit. And then France is also falling a bit. China I don't really look into. Iran is also steadily falling, although that's very, very methodical. I have a feeling that this is manufactured. That's too regular. This is like almost like what you see in grade school, where people would like kids would make up things, and they're like, this is not. I don't think this is real. Anyway, because real is, if you look at here, so it's up and down, up and down. The general trend is down, but not a stepwise reduction like they're showing in Iran. So I doubt that. But anyway, United Kingdom there's been a spike recently in the last 2 days. Turkey has been going up and up. The Belgians peaking-ish. The Swiss are also generally trending down, but there's a spike recently. Netherlands, but there. Canada, a peak likely. They have yet to, looks like, really trend down, so they're maybe hitting their peak. And then Austria is a really good country for reduction, and South Korea basically almost to nothing. So South Korea is the picture that you want to see, basically. See ups and downs, ups and downs. So that's normal. This is a normal curve. So, and then Russia, they just keep on going higher and higher. So, and then Israel, they're also decreasing significantly. So maybe they've controlled it, but yeah. So it looks like overall the coronavirus is still, we have yet to hit its peak, and things are going. The New York, for the United States, New York City is still the greatest number of deaths at 5,150, and then the surrounding area of Nassau shows 560. So we're looking about almost 5,600 or so, 5,700 deaths, unfortunately. And I read this article from the New York Times stating how hospitalization for the virus are nearly flat, but there's still deaths. So that's good. If they're saying hospitalization for the virus are nearly flat, that means likely the number of cases are not increasing anymore, and New York may have likely come to a plateau and is now beginning to see less and less of the coronavirus. So hopefully with social distancing, things are happening now. So that's good. Things, still things are bleak in New York City, and it's of concern. So they're showing the number of deaths in the in New York State. although that doesn't correspond to since yesterday. Oh, so this is yesterday. This is one day only. That was not corresponding to the 5,000 some odd deaths, but that was just one day. The confirmed cases, you can see her just statewide is 159,000. Heck, that's almost more than certain countries. Like, that's more than Spain. So, the confirmed cases in New York State alone are more than all of Spain. That's pretty crazy. So, um, and it's, New York is the one with a high dense population, but Central Queens is the epicenter of the epicenter. That doesn't sound good. Um, so it's really, really hard in New York. I can only imagine what it's like living in New York and what they're going through. But this is just it's very hard time there. So I don't know. But all in all, so far the coronavirus hopefully is beginning to come into likely a plateau. I will say that I was reading recently that I think the Prime Minister of Canada, Justin Trudeau, was mentioning how likely there won't be any normal until there's a vaccine. There's people were asking what is normal. He was saying that there won't be a normal until a vaccine is produced. And I sort of agree with him. Until a vaccine is created that's effective, people are going to be scared, and it's not going to be normal. So and a vaccine, the creation of vaccine is at least a couple more months away. Maybe we'll have full working vaccine by next year of this time, or maybe earlier next year, like in January. But this is something that's going to be taken seriously. Like, the concern is, sure, everything's gotten better and everything, but then you do relax social distancing, and those that do have the infection start spreading it, and there's like almost like a second wave of this. So the whole world has been turned upside down because of this, and I don't know, it's just hard. You can see there's no. So what I did want to do is I wanted to speak to you about a different topic. We can only do coronavirus so long before we start losing our minds. And today I wanted to speak to you about common childhood illnesses. And these are the things that you may see, or your child may see during this time. He or she may see something called respiratory syncytial virus. And it's like, it's basically an infection of the top of the bronchioles, or bronchiolitis. And it's like a flu-like symptom with fever, runny nose, and cough. And up to 40% of kids with RSV can also develop wheezing. And usually it's milder in older kids and/or adults. So you might see this as opposed to the coronavirus, and might be considered, oh, it's a corona. So I did want to mention that many times the ER will actually look for all of these various issues before they diagnose you with coronavirus. Another one that common childhood illness is ear infections. So kids are prone to get ear infections because of their eustachian tubes, or their small eustachian tubes. A eustachian tube is basically a tube that connects the ears to the throat, and it's there to equalize the pressure on the inside of your eardrum. And we all have them. We all need them. And in kids with infections, they can get inflamed and blocked, and that can cause the infection, like preventing a flow of fluid that can, if you prevent the flow of discharge or what have you, then that can become a breeding ground for infections. So usually the symptoms are fever, fussiness, and ear pulling. Like, kids will literally want to pull their ears, and mostly are due to viruses that go away on their own. You can, and the best way to help treat this issue, actually preventing this, is actually a vaccination, is childhood vaccination. So if you get all the various vaccines you're supposed to get, you can help prevent an ear infection from occurring. And you can also have them with outside of viruses, bacteria can also cause middle ear infections that would cause antibiotics. The next common childhood illness would be croup. Um, croup is sort of like it's a cough. It's a tight cough more than like it's a tight cough that sounds like a barking seal. Now I'm not gonna bark like a seal in front of you guys, but it's it's basically a cough, a chronic cough that doesn't go away. And again, sorry, this is due to a virus, and most kids get better on their own in about a week, and it's one of the most common issues that kids have under 5 years of age. So this can be concerning. A lot of these things people will go to their pediatrician for. Another one would be pink eye. Pink eye is a common cause for people to be admitted, um, come to the doctor for little kids. So your kids will usually be tearing, redness, itchy, clustered, crusty eyelashes are common, um, and usually it's caused by the same virus as a common cold, which is actually coronavirus is a variant of coronavirus. Pink eye will spread rapidly in schools and daycare centers. So that's why isolation actually for kids like this is necessary. So if you find a kid who has pink eye, don't let them come to school or stay in a daycare. Make them go home. And pink eye for kids will most likely clear on its own 4 to 7 days. So you don't need antibiotics necessarily for pink eye. Not always. And like especially since it's due to a cold. Sorry, it's due to a virus. So if it's due to a virus, antibiotics are not going to do anything for it. And next one is chickenpox. Chickenpox is very, very common, but this actually this is beginning to go away. We are now beginning to give the varicella vaccine, or we're giving the vaccine for chickenpox. So, like it says, now preventable through varicella vaccine. So, usually, I had chickenpox, and it's usually it starts off with just like a rash or little lesions all over the body that are very, very itchy. The good thing is it takes some time, but it goes away on its own, and it's not something of concern. But I would highly recommend you have your child vaccinated, and they never have to go through chickenpox. And there's another sidebar: is if you've had chickenpox, then you would need a shingles vaccine when you're age 65, because shingles is a reactivation of the chickenpox. Because chickenpox actually hides in the nerves of your body, and that's a place where the immune system can get to and cannot destroy it. So they will actually hibernate in your nerve cells. But if you are vaccinated against it, they never have a chance to replicate and get into your body. So I highly recommend having the chickenpox vaccine. The next one, most common one of childhood illnesses, is a strep throat. And usually, for a strep throat, is there sneezing or runny nose? It's more so due to a virus than to a bacteria. And signs of a strep throat include a sore throat that lasts more than a week, difficulty swallowing, excessive drooling, a rash, and pus is really the big one. Pus and fever over 100.4 degrees Fahrenheit is a big reason, and or contact with someone with strep throat. Strep throat is usually treated with antibiotics, and this is you should go to your doctor for this one just in case. Let the doctor differentiate if this is a viral versus bacterial, and this is something that commonly kids have. So RSV, since respiratory syncytial virus, is sort of like a cold, but affects more of the lungs. Ear infection is common only because the eustachian tubes are not like for kids. They get easily inflamed. They get easily blocked. Their eustachian tubes have more kinks and crevices as opposed to adults. Ours are more straight. It's easier for drainage to happen, so that's why we get less ear infections than kids. Croup is the barking seal cough is a common kids as a common cold issue kids get. Pink eye is something you should try to keep. Don't have them come to school. It's contagious. Usually cases clear up in 4 to 7 days, so you don't need antibiotics in general. But You should not have kids come to school or to daycares when they're having it. Chickenpox is something that can now be prevented. It's just basically a itchy rash with lesions when it happens to kids, but it can be dangerous for newborns, adults, and pregnant women. So watch out for those populations. That's why it's so important to get the chickenpox vaccine. And then strep throat is usually caused by bacterial. It can be caused by bacteria or colds, as in viruses. Go to your doctor when you have these kind of symptoms. Let us determine if you should be vaccinated, if you should get an antibiotic or not. So let's see if there's any other questions. Anyone asked any questions? No one's asked any real questions per se. So as you can see, the world has been suffering through coronavirus for some time. There's a lot of blame going around of who's, how fast did we react or whose fault is it? And at this point, it doesn't matter. All it means at this point is trying to prevent the spread of this disease. Luckily, it's not spread thus far, meaning it's not spread to the general population as much as it could have, only because of what steps we've taken as a world, and we have over 7 billion people, and so far we've only confirmed about 1.5 million. Likely, the total amount of people infected is much more. I don't know. I assume maybe let's make a really high estimate: 5 million people are infected. So 5 million versus 7 billion is pretty good if we can prevent. What we want to do is prevent the Spanish flu of 1918. It's not 1917. I'm not sure why that's being said, but it's 1918 for Spanish flu. And let's see if I can show you something. Spanish. Oops. Yeah. Flu. What am I doing here? And let's see if I can show you a chart. No, curve. Yeah, maybe curve. Is here good views? So let's see. They're showing different dates. So you can see for the Spanish flu, there was a large spike that happened in 1918 around September. Beginning of October, spiked really fast for about a month and a half. So look, if you think about it, look, that's 1 month, 2 months, 3 months, 4 months, and then it was a lapse, and then it came again for 1 month, 2 months. So that's what we're trying to prevent. We're trying to prevent this from happening. We're trying to make this curve much more lower and this not happen again, the second one. So this one, social distancing and hand washing and trying to not spread the disease will hopefully make this much less, and vaccines will hopefully get rid of this one. So we could anticipate this little tidbit. So if we were to use our data, we could say what? February, let's make this February 21st, and this is the beginning of March where it starts ramping up. March, and that's April, May. So by June, you would assume most of it is gone. But then if we're going to use this again, July and August and September, those summer months, there's another spike. So I don't know. We may need social distancing again during the summer months. Because if you can see here, the Spanish flu of 1918 had 2 spikes. It's not something that we can just, just play off. Here, if you notice, this is different cities. There are always 2 spikes almost. If you notice, if you look at the number of, this is basically going according to time, and this is the number of deaths, I believe. So if you notice, there's always a secondary spike in almost every single chart. So that's concerning. We can't just let this first wave go and say, oh, everything's okay, and then bingo blango, a month later there's another wave of deaths. So I don't think the world is thinking about this, that there's a second wave that will hit if we don't control this appropriately. Here's another one. pandemic-related causes. I think Ontario is Canada. This one's a Canadian one, I think. It could be Los Angeles as well. Percentage of deaths spike in Ontario cases and in U.S. cases. And let's see. This went away, but then there was another spike in pandemic deaths. I was according to age, so. But anyway, what I'm trying to say is we need to be mindful of the second wave that may hit. And then these are just different countries. Yeah. Okay, well, we're coming to the end of the hour, and I will again address you guys tomorrow about what's happening. Let's see if there's any questions. No questions per se. But we're just going day by day, day by day of seeing how things go. And I have a bad feeling actually the U.S. will hit maybe 1 million cases by when everything is said and done. And at the rate we're going, we may hit 1 million cases in the next week or so, maybe 2 weeks. That's going to be pretty bad. But the U.S. really needs to catch up with the rest of the world, and the fact that they are beginning to slow it down and control it, especially places like Italy and Spain and France, United Kingdom. I would say the best actually are two. It's Austria and South Korea. Those are the best two countries that have controlled this problem. But if you look at it, the total number of confirmed cases in South Korea, I think, is less than the number of deaths. Yeah, it is less than the number of deaths in the United States. That's the difference between South Korea and the United States. I don't know what the population of the United States of South Korea is, but still. Anyway, well, let me close this. This is a patient call. I'll talk to you again tomorrow. If you have any questions, feel free to ask me. And let's see. I just wanted to switch here. And I just wanted to say thank you again for being here with us. And if you have any questions, feel free to direct message me. Thank you again. Bye-bye.